Hey everyone, it's Nancy, the nurse practitioner. I am wearing my Halloween earrings because today happens to be Halloween, but it is also a really important month, the month that we make everyone aware about breast cancer, and that breast cancer can be prevented for some people if we have early detection. And so we're going to go over a bunch of slides together. It's going to take us a little time, so get yourself a cup of Joe and here we go. All right, I first want to tell you, though, that we need to talk about statistics. Do you know that it's the second leading cause of death in the United States, and there are plenty of ways that we can prevent breast cancer? Second leading cause is pretty hefty to me as a woman. So it's very important that we spend a little time and understand all the information we need. And, also men can get breast cancer. So listen up, all you guys out there. It's important that you know this. So we're going to share my screen. Okay, so I'm sharing this screen with you, and here it shows two punching gloves. They're both pink, but actually I think we should have pink and blue for men and for women, because men do get breast cancer too. And, it's important, like I mentioned, that we think about them as well, because it can go undetected. Now, I was an oncology a navigator for breast center for two different places, and I helped a lot of women and men get diagnosed and treated for their breast cancers. It was a very intense job. It was hard to actually tell people what was happening, reading mammograms with the radiologist, but I learned a lot, and I used it in my primary care when I saw patients to really look at them from an oncology point of view. So today we are going to talk about what you can do to reduce your odds of getting breast cancer. And we're going to discuss in this presentation things you can do to prevent breast cancer, how you can examine your breasts. So we'll go through that in detail, what to look for and feel when you're examining your breasts, the different imaging studies that are out there for breast cancer detection. What is the BRCA1 and BRCA2 genes? And that's really important to know if you have family history of that. And like we said, we're going to talk about men that they can get breast cancer as well. So here's a little history for you. This is about Charlotte Haley. She was a woman who actually had breast cancer, and she battled it and used actually peach-colored ribbons in the beginning as an awareness. She would make cards and leave them in grocery stores with a ribbon, and it was to show awareness that the annual budget was $1.8 billion in America from the National Cancer Institute, but that only 5% went actually to cancer prevention. And so this became a wake-up call for legislators to address this situation, and the color peach was changed to pink somewhere in 1992. So that's where we got the pink color from for our color for breast cancer awareness. And the other thing is the pink ribbon represented fear of breast cancer, but also the hope for the future and the charitable goodness of people and businesses who publicly support the breast cancer movement. So very cool about the pink. And I'm wearing a little pink for you today with my Halloween earrings, just because I should represent pink. So everyone knows how I feel about obesity and being overweight. It's a constant battle for many of us, but obesity is a risk factor for breast cancer, and being overweight can increase the risk of breast cancer from also recurrence. And those women that have obesity, they also have these fat cells in the breast, and these fat cells make estrogen, and estrogen is everywhere if you're fat or overweight. That's why many people do not necessarily get osteoporosis, because the estrogen supports them. And you could see that in one of my other videos I did on osteoporosis. But these extra fat cells make more estrogen than normal, and these hormone receptor positive breast cancers can develop and grow. And that's the deal about obesity. Obesity is not okay. It's also the most common obesity-associated cancer among women after menopause. Think about that. And many of us hit menopause by 50. That's like 40 years that we are at risk if we are overweight or obese. So take the steps to lose weight. 2 or 3 pounds a week to take off. Reduce your portions. Eat plant-based foods, get moving, walking, swimming, biking, gardening, do whatever you can to get yourself going to lose that weight so you don't get breast cancer. The other things you can do is avoid sugary drinks and while limiting energy dense foods, and limit consumption of red meats and processed meats. That's sausage, cold cuts, pastrami, prosciutto, yikes, all that stuff. So we're going to take a little bit of time and go over how to do a breast self-exam. Some of the experts do not think that doing a breast exam is necessary. They think that it actually causes more harm for some people because it makes them nervous and that they get unnecessary testing. The biggest point I want to get across from this video is that the more you know about what your normal breast situation looks like, you will be able to tell if there's something not right. And so doing your own breast exam in the comfort of your own home is something that should be done monthly for most of us, and should be done 3 to 5 days after your period starts, because that's the time when they're not tender, they're not lumpy, and it's easier to do it and you're in the middle of the cycle. If you're menopausal and you don't have a period anymore to judge this, pick a day of the month, like the first or the last, and you will be doing it the same day every month. So we're going to go over 3 things: a visual inspection of the breast, the manual inspection while standing up, and the manual inspection while lying down. And looking at this picture is the parts of the fingers, the middle 3 fingers, using the pads, is what you're going to use to touch your breast with. And you're going to go light in the same area, also then medium, and then firm, and then move to the next space in light, medium, firm, so that you're going all the way around the breast and into the tail of the breast, feeling all those depths to make sure you don't miss anything. So first you want to do is perform a visual inspection of your breast. Stand in front of the mirror with your shirt and your bra off, with your hands at your side, look side to side, look at your breasts. Are the nipples changing? Is one breast fatter than the other than usual? Is there crusting? Is the skin color changing? What are you seeing in the breast? So you're right now just looking at the breast. Then you're putting your hands on your hips. When you do that, it makes the muscles on the upper part of the breast contract. And sometimes if there's a tumor in a breast, the breast will not move, but the other one does. And that can mean something's not right. Then lean forward with your hands on your hips, let the breast dangle a little bit, and look for dimpling or any kind of puckers, because that's where usually a tumor will lie, behind the pucker. Okay, and then put your hands on your head. Again, you're watching for breast movement. Are they staying in one space or are they actually moving? Okay, and you're looking for any changes at all. Okay, and now we're going to go into while you're standing up, you're going to perform an inspection of the breast manually. Where the first picture showing those 3 pads of the fingers is the tail of the breast. I didn't know this until I became a navigator, that our breast tissue goes up in a little bit of a point out towards the armpit or the axilla. And not only do we want to feel lymph nodes in the axilla area there for any involvement, but we also want to feel that tissue right there, because it could be beyond the breast that there's a tumor. You want to then go either in a circular motion from the clavicle area around and around and into the nipple. And also at the bottom of the screen, you can see you have to squeeze the nipple because you're looking for any kind of discharge or pain. Okay. And then the next thing you're going to do is lie down. By the way, this whole procedure takes no more than 10 minutes. Put some music on, make yourself have a comfortable, safe space, and just do something for yourself once a month like this. Okay. Now you're going to lie down. You're going to put a pillow under the side that you're going to be examining. And what that does is it spreads out the breast tissue and allows, especially large breasts, to fall to the side so you can really feel around deeper into the chest tissue. Okay, and then when you're done with the one side, you're going to do the other. You can go in from your fingertips towards the center of the nipple, and following my cursor here, you could see this, where you'll go around this way from up and inward. Or you could start at the outside and go around and around and around going into the nipple. Or you can go up and down and up and down. Pick the way that works best for you, as long as you're going light, medium, and deeper into the breast to feel all the tissue. Okay. Your goal here is to get to know your breasts well. And this way, if anything new is happening, that's when you need to see your clinician. All right, so here are some of the changes that you want to look for. You know, is there a change in the shape? Is there a change in the skin color and the texture? Is the nipple changing? Is there a change in the shape? Is there more venous patterns that increase around the breast? And some breast changes that may indicate cancer, when you think about it, and these are changes that you're noticing, is a lump or thickening, an unexplained change in the shape, as we mentioned, skin color changing, shrinking of the breast or swelling, dimpling or puckering of the skin, skin that becomes irritated, scaly, or ridged, a thickening of the breast skin, or pain or burning sensation. And when you look at the nipples, you want to look for changes in the color of the nipple. Is the nipple pink when it normally was brown? Is it brown when it was normally pink? The areola is the colored area around the nipple, and that's what we're looking to actually for scaling or crusting. We are looking for an inward movement of the nipple. If you have an inward nipple, that may be normal for you, but it may not be, and it needs to be evaluated just to give you your baseline. You might have clear, milky, or yellow or blood discharge coming out of the nipple, or you might have tenderness or pain. And then let's look at the lymph nodes. This is a really important issue right now with the COVID-19 vaccine. So we're going to stop for a second and talk about that. You know, the lymph nodes are part of our immune system, and they collect infectious debris and move them through our circulation of our lymphatic system, and in response to a number of things, but including sometimes the vaccine has caused this. So for instance, my daughter, she called me up and said, my lymph node under my arm is swollen. And I said, did you just get your COVID vaccine? And she said, yes, she did. So I realized that was the problem. And I said, that's a typical or can be a typical problem post-vaccination of any kind, because your body's showing an immune response. So just something that you all need to know before you go for your mammogram is wait 4 to 6 weeks after receiving your COVID-19 vaccine before you go for that mammogram, because it may show a lymph node that's enlarged, and then it's going to take you hunting down a whole other situation. Okay, but back to lymph nodes in general, breast cancer can cause changes in the lymph nodes in early stages. A lump, there's swelling under the armpit, near the collarbone area, that's up near that tail of the breast we talked about, or a thickening of the skin in the armpit. And so we just basically went over all this. So just keep an eye on those lymph nodes too. Here's something else that can happen to women, is something called breast cysts. It's a normal finding, but it's abnormal for, when you find it, you're like, what is this? It's a movable, soft, oval, fluid-filled sac. And if it were fixed, we'd be concerned that it's cancerous. But if it's movable and tender, it's usually a cyst. And some of us are just cyst makers. And once you know your breasts and your clinician says, yes, you make cysts, they're non-cancerous. You just need to watch out for them. Some get really large and painful, and they need to be drained. And they feel like a balloon, actually. And something else is that most women do actually get breast cysts that can get out of any age, but mostly under the age of 50, which is before menopause. And some women do get it at other ages too, but mostly over 50, it's because of hormone therapy. So just want to make sure you know what a cyst is like, and they do feel like little grapefruits. Not to alarm you, but these are some of the kind of patients I would see when I would do breast exams. This nipple looks normal, as you could see. But look at this whole area here. When she lays down and the breast falls to the side, there's a dimple in here. And this, as you can already see, is probably a palpable tumor. And you see also this little pitting of the skin, and this is called peau d'orange, and there's also something deeper here. So this would definitely be an indicator of something serious going on and needs further evaluation. Another picture, this one is of a nipple crusting. This is not what a normal nipple and areola, that brownish area around the nipple, looks like. So if you've got crusting or this, pussy drainage, definitely have it checked out. Here's an example of nipple inversion. Some women just have them and it's benign, and one breast has it and one doesn't, and that's a normal finding for some people. But if it's something new and you've never had it before, definitely have to have that checked out. So here I am showing you that I'm going for a mammogram. I've got my gown on and I'm standing in the room getting myself ready to go. But I'm showing you that I do these things too. And if you've known me from my other videos, I took you through my colonoscopy. I've taken you through my bone density. I've taken you through my blood work, my fatty liver. So here we go. Here's the mammogram. And let's stop for a minute and talk about different imaging studies that are out there. Well, there's the digital mammogram, which we all know. We'll talk a little bit about how that has progressed over time. And then there's the 3D mammogram, which is really cool. And then there's the MRI, which many of us know. And there are certain people who need to go through this MRI. So we'll go over that in a few minutes. But let's start with digital mammograms. 87% of cases, a routine screening mammogram finds even the smallest sign of a problem. So that is worth noting. So if you have not had a mammogram yet and you're at least 40 years old, you should definitely be getting a mammogram. And we're going to go over more about that in a little bit. We're going to go over the difference between the 2D and the 3D mammogram. Let's take a look at the next slide. Well, before we do that, real quick, this is me going through my mammogram. You get this plate that is actually where the breast is placed. You are actually, you can't wear any deodorant. You're not supposed to wear any lotion. And when you come into this machine, basically it's an X-ray. And the process of it is similar to older mammograms. The patient is positioned where the two plates is flattening the breast and compressing it to get an angle of the breast. It's taken from top to bottom, and the x-rays are now taken digitally, so they can be stacked up instead of how they used to be on film. So they can look at old pictures pretty quickly with that. Okay, so that's what a mammogram looks like for those of you who have not done that yet. Okay, let's go on. This is what a mammogram looks like on the left. This is a 2D top to bottom dimensional picture. And this is the same breast having a 3D mammogram. So get a load of this and how that would have been missed right here if they didn't have a 3D mammogram. The difference with the two-dimensional images are only taken from front and side. And may create images of overlapping breast tissue, while the 3D mammogram renders images of the breast in multiple slices from various angles, and it makes it easier to find potentially worrisome abnormalities. I think this is so cool, especially for people with dense breasts, and we're going to go over that in a minute. So many studies have concluded that it's slightly better to detect cancer with a 3D mammogram, and since 2013, the FDA has approved it through Medicare and is paying for it. Okay. And the exposure is the same as the 2D. You may have an extra expense if you haven't been on Medicare yet, but it certainly seems worth it to go ahead and do it. Something we should probably go over is breast implants. They can impede a mammogram reading. So silicone and saline implants are not transparent on x-rays. So they need to be pushed to the side so that the mammogram can compress the breast tissue that's underneath the implants. And experienced technologists and radiologists know how to carefully do that so that they do not rupture this implant. Okay, very, very cool to see how this goes. This technology about 3D is really neat, and I've had that a number of times, and that's because of dense breasts. So we're going to look at this real quick because I want to tell you that here's the fatty breast on the left. And this is what a woman's breast looks like when she's getting older, gaining some weight, and also the breasts get fattier over time. And then there's some of us who have dense breasts. And you can see on the right how a dense breast gets really thick and you can't see through it. It's almost like a smoke screen. Okay, so the breast tissue that's dense has got less fat and it's more connective tissue. And you can see, wow, you can't see through that at all. So cancer also appears white on a mammogram. So tumors that can hide behind this dense tissue will be missed. So I'm kind of at risk because you can't see through the breast. So women with dense breast tissue have 4 to 6 times higher risk of developing breast cancer. And that's pretty scary. Also false positive results. 5% to 15% of screening mammograms result or require more testing, like additional mammograms or a sonogram. And most of these tests turn out to be normal, but and then a biopsy may be needed if something abnormal does come up. So I'm just saying that if you have dense breasts, you specifically need to find out what, about getting the 3D testing. And here's a result of my mammogram after I went. You can see it says I should have an exam every year for breast imaging, and that's because of the dense breasts. It says that I do have dense tissue and that it can make it harder to find cancer in a mammogram. And it's also associated with increased risk of breast cancer. So that tells me that I can't wait years. I need to go every year. I could look at more information on breast density at hvra.com. So interesting result. And this is what you get after you have your mammogram. So some of the things that are starting to become kind of confusing for people is, and a lot of the experts out there are indicating, what ages should you stop having a mammogram? Which age should you start having a mammogram? What do you do when you have dense breasts? So you could see that these are all the different experts out here giving their opinion about these particular age groups. So women with dense breasts like me, the US Task Force indicates that I should, have screening mammogram, maybe an ultrasound, digital tomosynthesis. And actually for now, that's been working great for me. And then the American Cancer Society says it's insufficient to recommend recommend for or against yearly MRI screening. And then look at the American College of Gynecologists. Screening with mammogram does not recommend routine use of alternative tests. Healthcare providers should comply with the state laws, blah, blah, blah. Wow, you can get your head spinning with this. So I got this offline, and this is why I feel breast self-exam and going yearly and trying to keep my weight under control is all something I need to do to keep ahead of this. So who are high-risk women for breast cancer? We're going to talk about the BRCA1 and BRCA2 gene mutation, and maybe we'll stop right now and do that because that's a very interesting thing. And I know many of you have heard about it before. So I have a friend, and her sister had ovarian cancer. It turned out she also had colon cancer, and I believe she developed breast cancer, and she did pass away. She was young. She was in her 40s. And I remember going to the wake, and this woman walked up to me, this sister, and said that she just found out that she went tested for BRCA gene mutation, and she had the gene mutation, then found out that her mother also had it. So it was throughout the family genetically, and she chose to have her breasts removed and have her uterus taken out. Pretty drastic, but the risks for breast cancer and other cancers was so high that she felt that it was important to do this. That is a story that I'll never forget. So let's go over BRCA mutation. Well, we're all born with both of these genes. And if one of these genes, the BRCA1 or BRCA2 gene, is damaged or mutated at all, the BRCA1 gene was first found in 1990, and the BRCA2 gene was found in 1994. But what it is these genes encode for tumor suppressor proteins, and the proteins are unrelated, but it causes the DNA to be damaged. And when there is mutation on either one of these genes, that repair process is compromised and there's a damaged DNA. And they have found that testing positive for the BRCA mutation spells an increased risk of ovarian cancer as well as other kinds of cancers. So let's go over that. If you have a BRCA1 gene that's been mutated, your risk of developing cervical cancer, uterine cancer, and colon cancer is elevated, and also for breast. And then the mutation of BRCA gene 2 is stomach cancer, gallbladder cancer, and bile duct cancer, as well as melanoma. That's incredible. So we're going to talk about how you know you're at risk for getting breast cancer. But first, let's go over some other things that you need to know. Are you at high risk? Family members would need to be tested if you've had a history of mantle or chest radiation before you were 30. And if you have a lifetime cancer risk for breast cancer of 20% or greater based on your family history. So how would you determine if you are at risk for breast cancer? Well, a lifetime breast cancer risk includes 7 factors: your age at your first period, your age at the time of birth of a first child, your family history of breast cancer, mother, sister, or daughter, the number of past breast biopsies you've had, the number of breast biopsies showing atypical hyperplasia, and your race and ethnicity. So if you think about that, those high-risk women could know that they fit into any of those categories. And you know what, maybe I'll put that information on my facebook.com/caregiver success, because you could sit down and say, am I at risk for breast cancer? And go through these 7 things and determine maybe I am at risk and nobody really told me that. So screening for women with mutations of BRCA1 or BRCA2. Now, you know you have the mutation, you've been tested, and you can see here, at 25 years old is when a breast MRI should be started, and every 12 months, and a mammogram 25 to 30 years old and every 12 months. Physical breast exams start at 25 years and every 6 months. A breast self-exam at 18 years old. So look what happens once you know your family history, how the imaging and exams change to a much earlier age. A CA-125 blood test is considered for people 30 years old, or and a transvaginal ultrasound. So, you know, you really want to be on top of it if you find out that you have a family history. And who should consider getting genetic testing? Well, if you've had breast cancer at age 50 or younger, you've had a triple negative breast cancer at age 60 or younger, ovarian or fallopian tube cancer at any age, more than 1 breast cancer diagnosis, male breast cancer, breast, ovarian, or pancreatic cancer, and if you're an Ashkenazi Jewish ancestry. Hey, that ancestry kit that we've been doing actually could show you that maybe you have a piece of Ashkenazi Jewish, and there is a strong correlation there for cancers. If you know you have a known mutation in a cancer risk gene, the BRCA1 or 2, breast, ovarian, pancreatic, or high-grade prostate cancer. Interesting, right? Prostate cancer in your dad could actually show that individuals on the same side of the family may have need for genetic testing for cancers that they may be afflicted with. Genetic specialists are really cool. They can help to determine if you, through your personal and family history, meets any of these criteria. So definitely don't not look into this. Now, time to talk about the men. Now, men can get breast cancer too. And I know that's going to blow your mind, but they can. They have breast tissue. They have a nipple. They have an areola. They have those lymph nodes. They have everything we have. And it all depends on genetics and environmental. And we're going to go over that, you know, men can get breast cancer too, though it's rare. But breast cancer is most commonly found in women, but 1 out of every 100 breast cancers in the United States is found in men, okay? The most common breast cancers they can get is the invasive ductal carcinoma. They can get invasive lobular carcinoma or the DCIS. All right, so those are the ones that they typically can get. All right. And what are the symptoms of breast cancer in men? The most common symptoms of breast cancer is a lump or swelling in the breast. So take a look at your breast, guys. Redness or flaky skin in the breast, irritation or dimpling of the skin, nipple discharge, pulling in the nipple or pain in the nipple. Very similar to what women get. Okay. Okay, so what are the risk factors for getting male breast cancer? Well, getting older makes us at risk for everything. We're born with the same body parts like an old car, and you can't replace all of them, and things do change. So the risk for breast cancer increases with age, of course, and breast cancers are found mostly after 50. Genetic mutations, inherited changes like the BRCA1 and BRCA2 gene we talked about shows breast cancer risk. Family history of breast cancer. A man's risk for breast cancer is higher if a close family member has had breast cancer. Think about that. Radiation therapy. Men who have had radiation to the chest have a higher risk of getting breast cancer, similar to what a woman can get. Hormone therapy. Drugs containing estrogen, a hormone that helps develop and maintain female sex characteristics, which were used to treat prostate cancer in the past, increases men's breast cancer risk. Klinefelter syndrome. This is a rare genetic condition in which a male has an extra X chromosome, and this can lead to the body making higher levels of estrogen and lower levels of androgens that can help develop and maintain the male sex characteristics. Certain conditions that affect the testicles, injuries, swelling, surgery to remove a testicle can increase your breast cancer risk. Liver disease, cirrhosis of the liver can lower androgen levels and raise estrogen levels in men, increasing the risk of breast cancer. And overweight and obesity, like we talked about with women, older men who are overweight or have obesity have a higher risk of getting breast cancer than men at normal weight. Okay, here we go again about losing weight. So what can you do to prevent male breast cancer? Maintain a healthy weight, get down there, avoid excess alcohol, get plenty of exercise. If you have a family history of breast cancer, you may consider getting genetic testing to see if you have the BRCA1 or BRCA2 gene mutation. And these gene changes increases your risk of breast cancer. People with these gene changes should visit their healthcare provider regularly and get frequent cancer screening. So it's important to know what you got going on. So remember that a mammo is your ammo. I just wanted to do that because I thought you'd really appreciate that. So I need to show you a couple more things, everybody. In 1997, when I went during my nurse practitioner training to Washington, D.C., I learned how to do pap smears and also breast exams. And they gave me this really cool shirt. And it's anatomically correct. It says on the front, breast self-exam, and it shows a concentric circle, and it's right where your breast is. And on the back of the shirt, it says, touch yourself, women's health consultants. Okay, where do you wear a shirt like this? I can't wear it to the supermarket and I can't wear it walking in the neighborhood, but I did wear it on the beach. And when I wore it on the beach, no one would ever see me again. A bunch of women came up to me and just circled around me and said, is that how you check your breasts? Show us how. And they read the t-shirt. And I thought, how cool is that? So I just thought you may want to know about that. That's a cute little thing. I dug that out of my drawer. It's like 25 years old. Also, something really neat that you may want to get are these little cards that actually on one side say breast self-exam tips, and then the other side is preventive information. You can get these for your doctor's offices. You can get them for anything you want. They come 25 in a pack. Hang them in the shower or on a doorknob. And some of them come with the calendar month where you pop out the month that you did your exam, so you know you did it and you don't forget. Very, very interesting stuff. So I want to share that with you. I hope you like this video. I continue to do these because I want to help us all stay well in America, all over the world. I wish you a good month for breast health awareness. This is Nancy, the NP from Caregiver Success. Please subscribe to my channel, hit the bell so you get more notifications. And I also have a great book out there called Caregiver Success on caregiversuccess.com. It will help us all age well together. Take care till the next video. Bye, everyone.